Welcome back, everybody. I'm Debbie Cox-Bolton, CEO of the New Deal. So glad you're here for the opening plenary session of our 10th annual conference. We couldn't be gathering at a more important time for our country. For those of you who joined us last night, I trust you woke up feeling as inspired, as hopeful as I am about the possibilities ahead, and that you're ready to roll up your sleeves and get to work in the next couple days. As we talked about last night, the challenges we face are great, as are the opportunity and the responsibility to meet the moment and build back better. The excitement we feel at having elected Joe Biden and Kamala Harris is palpable, and each new announcement about their administration an affirmation that we're moving in the right direction. In the months ahead, it's going to take all of us working with the new administration, starting with the exceptional state and local leaders from across the country, to help restore America's faith in our government and in each other. We start doing that by focusing on finding solutions to our biggest challenges. And today we're going to focus on three in particular: fighting the pandemic, addressing systemic racism, and ensuring that as we rebuild our economy, we're making sure that the social safety net works for all. I'm honored to kick off today's session talking with Dr. Leana, an emergency physician and public health professor at George Washington University. Dr. Nguyen's a contributing columnist for the Washington Post and an on-air commentator for CNN as a medical analyst. Previously, she served as Baltimore City Health Commissioner. Dr. Nguyen's been a longtime friend of the New Deal, and we've been particularly grateful to have her perspective and her expertise throughout this pandemic. Dr. Nguyen, welcome.
Thank you very much. I am happy to join you, and I'm glad to be having this conversation, even though I will warn you in advance that I am bearing not the most optimistic message today.
Well, I think it is a perfect time to have this conversation. And, as we talk about all these other challenges that we're going to be facing, whether it's the economy or anything else, really the baseline is getting this pandemic under control. So I think it's really fitting we're starting with this particular challenge. And let me start with kind of a baseline question here. We're meeting when we all know COVID cases are skyrocketing. To your point about your optimism, worrying reports about even worsening numbers as we head into holiday travel. So just to start, what's your assessment of kind of where we are right now and what you're expecting over the next few weeks?
Where we are right now, Debbie, is that we are living our worst case scenario, because so many of us in public health had warned of this moment of what would happen if we didn't suppress COVID-19 earlier on, that we're entering this winter when people are getting together indoors, in close proximity to one another, when pandemic fatigue has set in, when our country has gotten so polarized that something as basic as mask wearing has become a partisan touch point, that we're going to see this really huge surge in cases. And as of the time that we're speaking today, we have now surpassed over 200,000 new daily infections from COVID-19. Our hospitals are on the brink of being so overwhelmed that not only patients with coronavirus, but other patients are not going to be able to get the care that they need. We're now surpassed over 100,000 new hospitalizations. We're setting records every day for the last 2.5 weeks when it comes to hospitalizations, and it's only increasing. Yesterday, we just had the highest number of daily deaths. And we know also that deaths are a lagging indicator, which means that as we are seeing the cases rise, the deaths will only increase in the days to come. We will surpass 3,000 deaths per day. We might even surpass 4,000 deaths per day at this point. And by the way, we have not even seen the impact of Thanksgiving travel yet, because there's still a lag of time. And so the infections that occurred over Thanksgiving probably will first be manifest this weekend and early next week. And then we're going to see another massive surge after that. So where we are in the pandemic is a really dire point. And I think what I'm so concerned about on top of all of this is that people's behavior are not changing. Back in March and April, when we were first seeing the surge, even back in June and July, when there was another surge in the Sun Belt and the South and the West, at least we saw that our government officials were willing to dial up the restrictions, and that people were willing to dial back their in-person gatherings. But we're not seeing that now. And I'm really, really concerned about what the next several weeks will hold for us. We are on track to matching the horrific numbers seen in the 1918 pandemic. We are on track to seeing the types of numbers that we saw in world wars. And I think the worst part of it is that it doesn't have to be this way, and that there are things that we can still do right now in order to prevent that awful trajectory from taking place.
Yeah. Well, I mean, I appreciate your candor, if not your optimism. I think that we have to get this under control. So we need to deal with the facts as they are. To your point about what we should be doing, let's start with, we have so many elected officials with us today. Let's talk about public policy first. You talked about kind of the restrictions and whether we should be dialing back or not. Everything from school closures to restricting indoor dining, restricting gatherings, mask wearing. What is your best advice for the people who are thinking about making policy in their areas? How should they be looking at what options would be best for their community?
Yeah, I mean, I very much understand the competing issues that we have, and I think it's important for us to talk about, and I know that none of you will ever use this language, but I think one of the problems that's occurred is this framing of somehow public health is the enemy of the economy. It's been framed by politicians, unfortunately, and wrongly, as it's somehow Democrats and doctors that want to shut everything down. And Republicans led by President Trump want to open everything up. I mean, that's obviously not true. And we also know that the reason the economy is suffering is that we were not able to control the virus, that controlling the virus is not the enemy of the economy. Actually, that's what allows us to get our schools back. That's what allows us to get our businesses open. And so I think the messaging is really important, that we don't feed into this dichotomy, this false dichotomy of economy versus public health, but actually public health is the way that we will get economic recovery. And I actually think in this case that having public health leaders not speak out on their own, but joined by business leaders and economists is a really important way of getting that message back on track. And so to that extent, for all of you, if you are discussing policies or rolling out, especially if you're talking about new restrictions that have to be applied, right? At some point, when your hospitals are at the point that they cannot accept patients, when our 911 systems are so overwhelmed that you get to a point of calling 911 and an ambulance isn't able to get to somebody with a heart attack for 2 hours. I mean, that's a total collapse in our system. When you get to that point, dramatic actions have to be taken. And they are really hard, especially after all this time. People are really sick of restrictions, and I understand that. But having trusted messengers stand with you will be so important. And so, yes, I think a lot of people will trust what doctors and public health leaders say. They will trust what you as a Democratic leader might say. But I think it's also really important to recognize that for many people, we are not the trusted messengers, people in these groups, that you need to have a bipartisan group. For example, maybe having prominent Republican leaders join you will also be important in certain communities. In certain communities, pastors, religious leaders are really critical as the trusted messengers. Part of public health actually is recognizing that the most trusted messenger is often not yourself, and that the messenger, in addition to the message, is really important. One more thing I'll add to this too is that masks. Masks, again, I am very disappointed and very frustrated that masks have become this cultural symbol, that it's been portrayed as a sign of weakness rather than a patriotic duty, as actually President-elect Biden has called it. But I think we can also do our part to reframe the mask debate and say that masks are what helps us from closing down the economy. An estimate by Goldman Sachs found that universal mask wearing will lead to our economy saving 5% of our GDP and $1 trillion. So I think framing it in this sense as masks are what help us to get back on track might be important too.
Speaking about the messenger and the rhetoric that's been used, are you optimistic that with the change in the administration there might be a different message coming out of the White House that might help with this? And what are you hoping in terms of a public policy perspective from the federal government, as well as what state and local leaders can do on the ground?
I mean, we have already seen that the incoming Biden team has messaged very strongly about what they will do. We have heard them, for example, as one of their first acts, announce an advisory board of top public health experts and scientists and doctors, which is excellent. I hope that this group and other public health leaders will continue to have an elevated voice within the administration, will be in decision-making roles within the administration as well, not just as advisors, but also also as the key decision makers. I also think that the incoming Biden team needs to do even more with reaching out to groups who will be these credible messengers. So having economists stand side by side with public health leaders when announcing the steps that have to be taken to rein in the virus will be really important as well. On the federal level, and to speak to your point, Debbie, about federal policies, there are federal policies that I think would be very useful, starting with, and I'm sure you are thinking about this too, stimulus. I mean, it's difficult for us to ask people to stay home from work if they don't have a home to go to, if they are afraid of losing wages. Social distancing is a privilege that not everyone has. So passing stimulus and helping to make businesses, small businesses, and individuals whole so that they can abide by public health guidance will be really important. In addition, there needs to be a national approach to issues like testing, contact tracing, getting enough PPE and supplies, which is something that healthcare workers are running into problems again. Activating the Defense Production Act will be really important early on. Vaccine distribution. I mean, I'm very optimistic about the fact that we now have 2 vaccines that look like they are safe and very effective. But we know that it's not the vaccine that's going to save lives, it's the vaccination. And we need to, again, fund state and local health departments that are doing the work of standing up these vaccination programs. And there needs to be an attention to public messaging that, again, needs to be done at the local level. And so funding for local and state departments will be really critical here. On the local and state level, I think, again, all of you are the role models that people are going to be listening to. And so everything that you can do to spread the message. I mean, if there's one takeaway from all of this, it's this. We know that what is spreading COVID-19 at this time are informal gatherings. What I do not want to see happen is restaurants and bars to be shut down, only for people to be gathering in one another's homes. I don't want schools to close, only for kids to be gathering for play dates and birthday parties. And so it's just really critical that we spread the message. Do not gather indoors with people who are outside your immediate household. If you want to see people, see them outdoors, spaced at least 6 feet apart, recognizing that in many parts of the country, that may be very difficult. So maybe you reduce the time that you're spending with people. Maybe only have 20-minute get-togethers, because after that, it gets too cold. I hate cold weather, so I'd be very cold after 20 minutes, but still, that's better than 0 minutes, and it's certainly better than gathering indoors. So limit your non-essential travel. Do not travel over the holidays unless you absolutely must, and do not gather indoors.
Anything else? I've heard you talk in the past, Dr. Wen, about kind of how people can assess their risk at an individual level. What are those, you've talked a little about the time and the place, can you just walk us through that again, given the new, reality in which we find ourselves? How are you telling people to think about their risk and what they should be doing?
Yeah, so I think that, this is an important point because we wouldn't want I think there are a lot of misconceptions about risk. And the other thing, too, is we've learned a lot since the beginning, as in back in March and April when we issued stay-at-home orders. We didn't know about how outdoors versus indoors makes such a big difference. And so closing beaches and parks, not a good idea, because that's going to drive people indoors more. But we know that now. So what determines risk? Proximity, activity, time, ventilation, and mitigation measures. So how close you are to someone, the proximity is really important. The activity you're doing also matters. If you are singing, talking loudly, very different than if everybody is sitting quietly and just breathing, which also expels some virus particles, but not nearly as much as if somebody is speaking loudly. The time is really critical. If you are indoors with someone for 5 minutes, very different than if you're indoors with someone for 5 hours sitting around a dinner table. By the way, eating, you also, by definition, cannot have your mask on during that time. So eating, drinking would also be high-risk activities. Ventilation, very important. We now know that this is an airborne virus. And so if you have all your windows open and doors open and a fan blowing, very different than if you are in a closed room with people. And then the final factor that's really important is mitigation measures. We know, for example, that masks will reduce the rate of transmission by 70 to 80%. And so this is the reason why, for example, if we're thinking about kids in school, if you have reduced capacity in classrooms where everybody is wearing masks, where the class is well ventilated. The ventilation is increased, there are air filters, maybe windows are open. That will, and then everybody is spaced at least 6 feet, ideally 10 feet apart. I mean, that makes for a much safer environment than if any of these are not followed. So I think another concept that people should keep in mind when thinking about risk is that of cumulative risk. So just because you're doing one activity that is high risk, that should mean that you should cut back your other high risk activities. I know a lot of people who have the opposite impression who will say, well, my kids are back in school, so we might as well also have play dates, or I'm back at work, and I have to take public transportation, and so I might as well also have dinner parties. That's not it at all. Rather, you should be thinking about, if I'm doing these high risk activities because they are the things that I care about the most, then what are the other things that I should be cutting back in order to prioritize these highest value activities?
I think that's super important. I don't know that people look at that holistically like you're talking about. I think that's really a great message. You mentioned, Dr. Wen, the vaccines. Obviously, we're all so excited about the great news that's been coming out in terms of the timeliness and the what looks like effectiveness of the vaccine. What will you be watching for in terms of, as those start to roll out later this month? What are you thinking about in terms of access and prioritization? And how do you see kind of the timeline playing out over the coming months in getting more and more people vaccinated?
Yeah, so the CDC had their committee for their advisory committee on immunization practices just met this week and on Tuesday, and they came out with a national framework of who should get the vaccine first. And I think it should be no surprise in terms of the two groups that they are prioritizing. First is healthcare workers. We know that if our healthcare system is overwhelmed, that we don't have a functional healthcare system. And so we need to prioritize healthcare workers who are on the front lines, treating patients who are getting exposed the most. Also, nursing home residents. Nearly 40% of those who have died from COVID are nursing home residents and staff. So clearly an extremely vulnerable group, and also a group that will become ill and will then also overwhelm the healthcare system. And so prioritizing these groups, I think, makes a lot of sense. Ultimately, the decision is actually up to the states about exactly how they're going to allocate the initial amount that they're given. So the initial amount is about that we'll be able to vaccinate about 20 million people. So 40 million doses is a 2-dose vaccine, 20 million people. That's not a lot. And states it'll be in their power to decide how exactly they get the doses that they're allocated. I would expect if the FDA is meeting next week, they have an advisory committee that by all accounts will probably sign off and give emergency use authorization for the Pfizer vaccine, probably also the Moderna vaccine by the end of this month, which means that the first group to receive the vaccine will get shots in arms by the end of this month. By early next year, hopefully we'll have approval for the general population, and then other priority groups, other essential workers, firefighters, police, teachers, et cetera, meatpacking workers, et cetera. They probably will be prioritized as well, and will probably be able to have the vaccine by early next year. I would expect that for the general populace, for most Americans, if all goes according to plan, that we should have access by late spring. There are some concerns that I have, including about children, because right now the vaccine is still, the Moderna vaccine hasn't even started being tested on children. The Pfizer is just beginning to get tested on older kids, 12 and older. It's really important that we get the testing done for children so that kids can come back to school at least by the fall. And I hope that that's something that these manufacturers are going to be prioritizing too.
Are you worried at all about any reluctance from people to take the vaccine? I saw that President Obama and other folks have even started to say that they would be willing to take the vaccine on camera so that they can show the safety of it. You know, as thinking again about so many people that are with us who have platforms to help message, thinking about getting ahead of the messaging on the vaccine. What advice do you have to kind of, try to help make sure that the most people will be willing to take this vaccine so that we can get where we need to be?
Yeah, and actually, I think that's something that all of you need to help us with too. Again, we know that the vaccine is not going to be effective in saving lives unless it is trusted, unless people literally take it. And so it really is important for all of you to help us to spread the word. And I think you can do that by all of us rolling up our arms and getting the vaccine when it's our turn, not jumping the queue, but waiting our turn and getting the vaccine. I love this idea about the presidents getting the vaccine on camera. I think for many people, they will trust President Bush, President Clinton, President Obama, et cetera. I think that's a great idea. I think also sports stars, entertainment figures, other people within the community, pastors. I was just talking to one of the local pastors in Baltimore who said that he plans on having vaccinations at his church and that he will be the first in line to get that vaccine. I think that will go a long way too. We have to also meet people where they are and recognize the reasons why people are not getting vaccinated. Some people are not getting vaccinated because they are anti-science. It may be harder to win them over. Some other people really believe in science, but they're concerned about political interference that may have influenced the vaccine approval process. We need to say very clearly that no shortcuts are being taken. And then I think still others may come from communities that have been the subjects of unethical and illegal experimentation before. And for these communities, there needs to be active outreach to rebuild that trust that cannot be done overnight.
That's so important. Thank you for that. I think it is important that we all get ahead of that now. Let me ask you this question, Dr. Wen. What do you tell people who ask, just when is this all going to be over? You mentioned it earlier. That people are getting tired of restrictions, and that's frankly understandable potentially, but not, just not okay. So in terms of messaging and helping people understand, the light at the end of the tunnel, what's your advice on how to talk to people about, when are we going to be done with this? Why do I have to stay diligent for a little while longer? What's your message to them?
Well, we have great news about the vaccine, but the vaccines are not going to help us this winter. Hopefully, it'll help us by the spring if we all take the vaccine. But here's the thing, we just have to hold out for a little bit longer, not that much longer. And I know that people have sacrificed so much, that Americans have given up so much and have already suffered through a lot. But how tragic would it be for us to continue to lose thousands of lives a day when we have the end in sight, when we know what needs to be done? And so I know it's asking for a lot more, but we can do this together.
Yeah. I just want to thank you so much, Dr. Wen, for being with us and for, you've been such a constant presence throughout this pandemic on TV, and you've also been a great resource and ally to our elected officials around the country when they are working on these issues. So I just want to thank you. I guess my last question for you is, just any advice to those people who are out there being the messengers like you are. There's, with this backdrop of the vitriol and the divisiveness, kind of any last words. It is a sobering message you're giving today, but also any last words of hope for the people who are out there on the front lines trying to make sure that people are staying the course, the messengers out there.
There is a saying in public health that public health works when we are invisible. That by definition, the work that we do worked when you don't see it, because we prevented something from happening. And so sometimes it's frustrating because you see the people who are not wearing masks and who are not complying with the public health guidance, and you see the people who end up in hospitals, but you don't see all the people whose lives you saved. And I just want to emphasize that for all the elected officials, because you are on the front lines of this fight too. If you are a mayor, a county executive, you are the one trying to protect your population by issuing orders that are really unpopular, but need to be done. If you are a city council member, a county council, a state legislator, et cetera, you're making policies that, again, that many people are unhappy with. And it's really difficult to do the right thing. It's easy to do the right thing if everybody agrees with you. It's difficult to do the right thing when you know that you will be on the right side of history, but people are angry with you now. And I just want to remind everyone that you are actually making a difference, that you are the first line of defense. Physicians, nurses, respiratory therapists, we are the last line of defense. We will be there when patients become desperately ill, but you are the ones helping to spread the message to prevent people from getting sick in the first place. And that work cannot be underestimated. And I just want to thank you for doing that.
Thank you for that. Thank you so much for all the work you're doing and for just reminding us to stay vigilant, and that we're going to get through this eventually. So thank you for your time so much, Dr. Wen. Really appreciate you being here.
Of course.
And now it's my pleasure to turn things over to take a different topic up, and I want to turn things over to the co-chairs of the forum's education working group for a really exciting announcement.
I'm Georgia State Senator Leana Parent, and I was thrilled when New Deal asked me to co-chair their new education policy working group.
Hi, I'm Stephen Reed, Mayor of the City of Montgomery, Alabama.
I'm Mayor Christopher Cabaldi from the City of West Sacramento and one of the co-chairs of the New Deal Leaders Education Policy Working Group.
Too many students are getting lost right now or graduating high school without the skill set that they really need to compete in today's economy.
I wanted to be a place where everyone could live, learn, and earn. And the earn part was important, but so was the learn part.
That's why we came together as part of the Education Policy Working Group here at New Deal Leaders to put together actionable recommendations that can be undertaken at every level of government.
And we knew that we wanted to take a look, led by the Alliance for Excellent Education, at breaking down some of those silos that are creating that disconnect.
The 1950s distinction between vocational and academic has disappeared. And now our systems have to adapt in order to make that a reality in the way that we deliver education.
In Georgia, we have a very strong dual enrollment program that's enabled kids to get a head start on earning college credits while still in high school.
We believe that there are examples out there, whether it's some in Georgia where students can take dual enrollment courses at any private or public institution, that we can duplicate.
Easing that transition between high school and college and engaging businesses on the front end so that they can tell us and help guide us to know what is going to equal success down the road.
What we know is that everyone needs career education. Even if you're going off to study philosophy at Harvard, it's still critical to learn how to succeed in the world of careers and to be prepared to change careers and change jobs repeatedly over time.
And we also talk about better professional development for teachers so that they too can help their kids navigate the college and career pathways.
Be able to put together findings as well as a way forward for our high school students to be better prepared for college and more importantly, be better prepared for the workforce that they will encounter in the 2020s and 2030s and beyond.
And this report captures the best practices. It's a report for policymakers, by policymakers, and by policy entrepreneurs to make this system a reality so that our young people have a future in which they are the masters of the robots and they are the masters of their own destiny, because we've set the table for the policy change to make that a reality.
I think you'll really like the report. Go ahead and give it a read and take these great ideas back to your districts and states. Thanks again to the New Deal, and have an awesome conference.
Welcome back. I'm Amanda Edwards, a former Houston City Council member and also a former New Deal leader. I happen to serve now on the New Deal Board of Directors, and I'm excited to join you today to talk about a very important topic on race, education, and what's going on in America right now. We are very privileged to have as our very special guest former U.S. Secretary of Education, John King. We'll be talking about the national reckoning as it relates to race, and I am excited to have him join us. Secretary King, welcome.
Thanks so much, Amanda. Looking forward to the conversation.
Absolutely. So just a brief introduction of Secretary King. He himself was a product of public school before becoming a public school educator and principal. He was the first Black and Puerto Rican to serve as the New York State Education Commissioner before becoming a U.S. Deputy Secretary of Education under the Obama administration. He later became the Secretary of Education under the Obama administration as well. He has served as and is serving as the president and CEO of the Education Trust and leads an initiative called Strong Future Maryland, which focuses on ending systemic racism and building a more equitable and just prosperous state. So welcome, Secretary King. We're so excited to have you, and thank you for all of your service in this very important arena.
Thanks so much.
So I'll jump in right away. And I know that race is obviously an issue that is not a simple one and has very complicated roots. And so I want to hear from you in terms of some of the challenges that you saw when you were serving in your role as Secretary of Education as it related to race. And where do you think we stand today?
Well, look, the sad reality is as a country, we give the least to the students who need the most. Low-income students and students of color systematically get less access to the things we know are most valuable, less access to quality early childhood education, less access to resources, less access to well-prepared teachers, less access to advanced coursework like APs or advanced career and technical education, less access to support in making their transition to college, and Black and Latino students are systematically underrepresented in higher education, including in our public higher education system, where our state flagships, which ought to be very representative of their states, actually underserve in state after state Black and Latino students. And the result is the continuing racial wealth gap, inequitable access to economic opportunity. And so for me, addressing education equity is central to addressing issues of racial justice in our society.
And in light of the fact that this has been a pervasive issue that did not start and end in recent times, of course, goes back and dates back to the times of slavery even, what do you think are some of the initial next steps that maybe a Biden-Harris administration would need to take as it relates to addressing issues of systemic racism in our education system?
Yeah, well, there are some things they could do very quickly through executive action. So the current administration, the Trump administration, withdrew, for example, guidance we put forward in the Obama administration around discipline to try to address the racial disparities in discipline. Think about the fact that Black girls are 5 times as likely to be suspended from school as white girls. So we put forward guidance to address that. That was withdrawn. We put forward guidance to help school districts understand how they could pursue school integration strategies. That was withdrawn. So those are 2 immediate actions they could take to restore that guidance. Long term, they'll need to work with Congress to address some of these deeper structural problems that we have. Now, President-elect talked during the campaign about tripling Title I. That's the main federal funding source for low-income students. That would be a powerful step. If you could tie tripling Title I to maintenance of equity, that would require that states address their own state funding formulas and protect their highest needs districts from cuts in this difficult economic environment. That would be very powerful. Doubling Pell Grants, the main federal funding stream for low-income students to access higher education, would have a very positive impact for students of color being able to not just get to college, but succeed there and graduate. So there are some more bold actions, but those will require congressional support. And we all know that may be a challenge, depending on how things turn out in Georgia.
Yes, everybody stay tuned to the Senate race in Georgia, because so much is definitely lying in the balance there, as we know. Now, you mentioned something that I think is important, because oftentimes when we talk about issues, we talk about them in silos. We talk about education as if the criminal justice system is not uniquely intertwined. We talk about healthcare as if that's something that is disconnected from issues of education, housing. All of them obviously creates a whole community and an opportunity that people can either utilize to thrive, or that holds them back. And in many of our communities of color, for example, those issues are issues that have been under-addressed, under-resourced. And so from a holistic standpoint, do you believe that there will be an agenda that kind of holistically invests in communities so that all tides will rise in terms of access to opportunity, so people can actually be successful and not be in the school to prison pipeline, for example?
Well, there has to be. I think you're exactly right that these issues are all deeply interconnected. So we have 30 million plus kids every day who rely on school for meals. We have 14 million kids today in this country who are food insecure. We've got to make sure kids eat if we want them to be able to thrive in school. We know that there are kids who struggle academically because they can't see the board or can't read the book because they have unaddressed vision care issues. So access to health care is an education issue. We know that a significant percentage of the folks who are incarcerated don't have high school diplomas. Their lack of ability to access educational opportunity is directly related to their involvement in the criminal justice system. So we have to see all of these issues as interconnected. I do think the president-elect prioritizing racial justice and prioritizing economic recovery from COVID is a good sign. Those pieces have to be connected. And we need states to do the same thing. We need state leadership that is forward thinking, that's asking, well, if folks are incarcerated, when they come home to the community, what are we doing to make sure they can find housing, get access to a job, get support through the reentry process? Otherwise, prison becomes a revolving door. We need state leaders who are saying to themselves, what are we doing to ensure there's a supply of affordable housing? Because if kids are homeless or underhoused, they struggle in school. So one of the things I love about the work at New Deal and the kinds of conversations you're having today is this deep understanding that people live intersectional and intersectoral lives. And that we have to not think in silos, but think in deeply interconnected ways.
Well, Secretary King, you did a wonderful job of transitioning me to state and local discussion of this issue of race and education and criminal justice and the like. And of course, as part of the New Deal, folks all around the country, from local government to state government, have been working on these issues. What do you foresee being one of the biggest needs in light of COVID, this pandemic, and coming out successfully, especially with things like the digital divide really having disproportionate impact and disparate impact on communities of color, for example?
Sure. Well, we certainly need help from the federal government, right? We need congressional action on a stimulus. All the state and local officials who are with us understand that if the federal government doesn't provide additional assistance to states and to local governments, folks are going to be facing cuts, 5, 10, 15% cuts, and that will be devastating for services. So we need help from the federal level. But at the state level and the local level, I think there's an opportunity to ask, how do we, as the president-elect would say, build back better? That it's not good enough to just go back to how things were in February 2020, because that was inequitable. So what does it look like to finally take action on the digital divide? Look, we had the homework gap before COVID, where 79% of white families have internet access, 66% of Black families, 61% of Latino families. But during this COVID period, that's meant some kids can't even log into school. It's meant folks can't access telehealth services, right? And so this is a moment where we should say, how do we solve that in our community? How do we make sure that every family can get internet access? How do we, as we think about economic recovery, make sure that's not just the affluent folks who experience recovery, but that we have an economic development strategy that reaches high needs urban and rural communities? How do we lower the barriers for small businesses to getting started and to growing? And I hope that we will see this really as a New Deal moment in the tradition of FDR and ask, what are the structural changes we can make?
Yeah, and it's an opportunity for us to reimagine, re-envision the way that we've been doing things, because I think at this time, we've gotten people's attention in a way probably before the pandemic we would have never had. People understanding as a kitchen table discussion some of the issues like digital divide and how that has an impact on students and their ability to succeed. So let me turn to your work with Strong Future Maryland, and kind of there's a bent on social justice and criminal justice as well. Can you share a little bit about some of the successes and some of the opportunities to succeed as it relates to the work with Strong Future Maryland?
Yeah, so I started Strong Future Maryland because I want to make sure this is a New Deal moment in Maryland. And for me, that means we've got to do a few things. We've got to invest in education. Our governor vetoed a significant effort in the legislature last year to reform school funding in the state to get more resources to high needs districts. A very short-sighted decision. So we got to override that veto. The governor vetoed new funding for historically Black colleges and universities in the state, even though they play a critical role in driving the growth of a Black middle class in the state. We got to override that veto. So we're working to do that. We've got to make sure that our economic recovery reaches Baltimore City, reaches out to the eastern shore of Maryland, to western Maryland. And that means we got to invest in things like career and technical education as part of K-12. We got to invest in our community colleges so that folks have access to training for new jobs. We've got to invest in public transit so that folks can access where their jobs are. There are folks within the city of Baltimore who have to spend 2.5 hours on buses to get to work. We should solve that with a better approach to public transit. We've got to approach recovery in a way that's sustainable. We know we're already seeing the effects of climate change. That's wildfires in California, it's hurricanes in the southeast, but it's also flooding in Ellicott City and other places in the state of Maryland. So we're losing coastline, actually, to climate change. So we've got to think about renewable energy. There are good jobs to be had in offshore wind, in solar, in electrification of buildings and houses. And we've got to acknowledge how deeply interconnected we all are. Hopefully a lesson from this COVID period for everyone is that all of our fates are bound up together. There are affluent folks who never thought before about what it would be like to be without childcare. Now they're very conscious of how important childcare is. So let's take this as a moment to make high quality childcare universally accessible. There are folks who maybe didn't think so much about the exceptions to our paid sick leave law, but now realize, hey, it's really important that everybody is able to take paid sick leave because their health is my health. The health of the community is going to affect the health of my family. So our goal is really to build a movement to take advantage of this opportunity where folks, I think, are experiencing a greater degree of empathy for those who are struggling. Take advantage of that to say, let's strengthen our social contract. Again, in the New Deal tradition.
And that is extraordinary work. What do you see as some of the main or primary obstacles that would come between you achieving some of those goals and the efforts that you're extending right now?
Yeah, well, I think two things. One is, we're in this moment where we have sort of a deficit of hope, right? And folks have felt very beleaguered by COVID, beleaguered by the ways in which the Trump administration was hostile to so many of the priorities we all care about, hostile to communities of color, hostile to immigrant communities. And so there is this sense of loss of faith that we can make things better. And one of the things I loved about being part of the Obama administration was President Obama's consistent message that we could build a better future, that yes, we have struggles, but we could build a better tomorrow. That resonated with me. That's true of my own life. Both my parents passed away when I was a kid. My mom when I was 8, my dad when I was 12. School saved my life. People having hope for me, despite all those challenges, saved my life. People investing in me. And so I think we have to close this hope deficit. And then we also have to close this expectations gap where people say, well, we're in this financial crisis. There's nothing we can do. We can't really afford to invest in education. We can't really afford to address climate change. We'll have to deal with that later. And to me, that's exactly backwards. I mean, part of the message, I hope, of the New Deal discussion is this is exactly the moment where we should be making those critical long-term investments. This isn't a moment to shrink Hoover style from the challenges we face. This is a moment to step up to those challenges and to be even more ambitious about what can be accomplished.
And let me ask this, what advice do you have for state and local policymakers who are embarking upon this potential for, as you didn't put it this way, but a renaissance of sorts where we really can begin to reimagine things? What advice do you have for them in terms of taking advantage of this moment?
Yeah, so 3 things. One is President Obama would make the point that better is good, and that we have to see progress as valuable. We're not necessarily always going to get the whole thing that we want, but we make incremental progress, and then we pass the baton on to the next generation. So I think being very strategic about what is achievable is critical. 2, we got to organize. Right? We're all counting on Stacey Abrams. She did an amazing work to help the president-elect to win Georgia, and we're all counting on that work continuing as we move towards these Senate races. But what Stacey's example illustrates, I think, is the power of organizing, the power of inviting into the conversation people who haven't participated, people who've lost hope, people who are skeptical about politics. Inviting them into the conversation, spending time listening to them, their concerns, and convincing them that we can achieve more. So that organizing work, I think, is critical. And third is lifting up the voices of the people who are impacted. I'll give you one example. One of the things that I'm very proud of that we worked on in the Obama administration was a pilot project to allow folks who are incarcerated to use Pell Grants. A mistake that was made in the 90s, in the 94 crime bill, was to ban access to Pell Grants for folks who are incarcerated. This caused thousands of programs in prisons that were providing higher education to close. So we created this pilot project. We still are working at the Education Trust where I work. We're still working to get Congress to repeal that misguided ban. But that pilot project has allowed thousands of folks who are incarcerated to have access to higher education. What is so powerful is when they tell their story. And I've talked with folks, very conservative governors, whose whole view about Pell Grants for incarcerated students was transformed by going to a prison, meeting with the students, hearing about their experience, hearing how transformative it was for them to have those educational opportunities, and not just for them, but for their families. What it meant for their kids to see them pursuing education, what it meant for what they'd be able to do when they got home that would be different from what they were doing that got them into prison in the first place. So lifting up the voices of those who are impacted, whether it's folks impacted by the criminal justice system, the folks who are impacted by our healthcare disparities, the folks who are suffering environmental injustice and experiencing the toll that environmental injustice takes. Like, if we can put those voices forward, we can not only mobilize, but we can persuade, and we have to persuade those who maybe are skeptical or reluctant that the kinds of policy changes we want are necessary and in the long-term interests of the country.
Absolutely. And I think those are really sound pieces of advice. And so often it's the case that there are not faces next to and names next to the stories that we hear anecdotes about. And so having that associated with it, I think is very, very impactful and great advice. I think one thing that is striking to us in the era of George Floyd's murder, injustice with regard to Breonna Taylor in terms of racial justice is, where do we go from here? I'd love to hear your thoughts in terms of what you would like to see happen as we've now garnered the attention of people internationally on issues of race here in America. What do you think are the next steps in terms of really getting that high level of engagement? There was a time in which corporations, in the aftermath of George Floyd's murder, were sending out statements of disavowing racism and the like. Now that those statements have been issued, what would you like to see happen in America? What do you think are next steps in terms of really addressing issues of racial justice?
Yeah, it's such an important point. I think, to me, the question is, can we go from what I would describe as performative wokeness to policy wokeness? The statements are nice, but the substance is what matters, right? And so I want to know, if you're a corporation and you put out one of these, important statements of solidarity in the spring, what does your C-suite look like? How diverse are your executives? What does your board look like? What kinds of suppliers are you using? Are you intentional about looking at opportunities to work with other businesses that are owned by people of color, right? What are you doing to make real that rhetoric? If you're a school district, who's in the AP classes? And do the AP classes look much more white and affluent than the other classes in your school? If that's true, what are you doing to change that? How are you making kind of a substantive difference? And on policing in particular, I think we've got to ask, of course, we need accountability for officers who abuse citizens. Of course, we need changes to use of force policies, but we also have to reimagine public safety. We have to ask, are we asking police officers to do things that really should be done by mental health professionals? Aren't we putting people into the criminal justice system who really just need good drug treatment, substance addiction treatment? And shouldn't we be investing in that? Shouldn't we be creating more jobs in high needs communities and making it easier for folks to access jobs? Shouldn't we be doing smarter efforts to help people with reentry so that we don't have the problem of sort of a chronic revolving door around incarceration, right? So we have to think systemically, not just respond in the moment, but get at these deeper structural challenges.
Well, Secretary King, this was such an insightful conversation, albeit brief, one I think that will stick with the New Deal leaders as they embark upon governing in a time that is unprecedented, but in a time that really presents a tremendous amount of opportunity. So I want to thank you on behalf of the New Deal for being one of our special guests today and for the insight that you shared, and of course, the service that you have already rendered and that you continue to render in your work in Maryland. So thank you so very much for joining us today.
Thanks for the conversation, and thanks for your leadership.
Thank you.
This is Michigan Lieutenant Governor Garland Gilchrist.
I'm Brooke Learman, a state delegate representing Baltimore City in the Maryland House of Delegates.
I'm Lee Harris, Mayor of Shelby County.
I'm Tobias Reed. I have the honor of serving as state treasurer here in Oregon.
I'm Phoenix Mayor Kate Gallego. I'm honored to serve as one of the co-chairs of the New Deal Renewing America Task Force.
I'm also proud to be a co-chair of the New Deal Renewing America Task Force.
We have convened a task force in order to bring the best ideas around navigating the COVID-19 pandemic.
It is laid bare that huge challenges are truly confronting our country and all of our communities: the racial wealth divide, the lack of racial justice, and the challenges confronting families and parents.
It's been a difficult year, but it's going to be a turning point. New Deal is part of that conversation, putting forward great policy ideas so that as we partner with the new administration, we can build a stronger America.
President-elect has it right. We have to build back better. We have to build back better in a way that allows people to live up to their full potential, to have a fair shot. And we have to build back in a way that is better for everyone.
How do we mount a safe and careful economic recovery? We have done that. New Deal leaders around the country have created all sorts of new programming, including financial supports, to get businesses, small businesses, back on the road to recovery.
A big part of that is modernizing the social safety net. We've always been special in this country by recognizing that we're all connected to our neighbors across the street and across the country.
As we look at renewing America, our transportation system has to be part of it. Transportation moves our country. It connects our kids to schools, our workers to their jobs, people to vital services, including healthcare.
The child care industry is in crisis, and that means that every working parent and family is in crisis too.
During the pandemic, we've seen that too many school-aged children do not have access to fast enough internet to be able to learn at a distance.
As always, New Deal leaders are on the frontier of really moving America forward.
The Biden administration is going to be investing in transportation and infrastructure. We want to do it in partnership with them in a way that is greener, more sustainable, more efficient.
As proud as we are of the work we do as New Deal leaders in our states and communities, we recognize that the power of the New Deal is as a network, and we couldn't be more excited to work with a Biden-Harris administration.
That is part of the future that will indeed renew America's vitality, our strength, our ingenuity, and fulfill our promise.
That's part of the reason that I'm so proud to be working with the New Deal and with all of you to confront the great challenges before us today.
We need to make sure that every person can be their best selves, no matter what they want to pursue, no matter who they are or where they live. Let's renew America together. Let's connect our people, and let's stand tall.
Good morning from Oregon. I'm Tobias Reed, and I am really excited to be with you all this morning. Of course, I wish we could be together in person, but trust me, when you've been staring at the same basement walls as long as I have, you all look pretty great. More importantly, I know that you're all talented, creative, committed people, and I'm really looking forward to the conversation this morning. The task force that you just met has been doing important work over these last few months as we've come to terms or begun to come to terms with the implications of this pandemic, and I've been honored to be part of it. There's not a lot that is good about COVID, but as we're all trying to find and cling to silver linings, one thing that I'm thinking about is the fact that COVID is forcing us to acknowledge that things are not going to look the same going forward as they have in the past. And that's a good thing. I'm really glad that this task force has not let the restoration of some previous status quo be the height of our ambitions, because for a lot of people, The good old days were not so good. So as we look forward, we get a chance to reimagine things, to think about how we want to remake them and rework them. And today we get a chance to dive into at least one aspect of that work. Remaking and reimagining, strengthening the social safety net is obviously central as we think about an economy that's in the midst of restructuring itself, dealing with the implications not only of COVID, but of increasing automation and artificial intelligence, of climate change, and a whole host of other things that I'm not even thinking of at the moment. So this is a timely conversation. And we're lucky to be joined by two experts. I want to introduce them very briefly and then talk about a question to get us started. Nan Whaley is with us. She's the mayor of Dayton, Ohio, but at least as important as that title, which she has held since 2013, is the fact that she's a leader with a really useful perspective about how the public sector and the private sector can work together to take on big problems like pandemics. She's also one of the leaders of a regional coalition of mayors who's making a really compelling case about the importance of middle America. I hope she's going to talk about that, among other things, today. We're also lucky to be joined by Laurel Blatchford. Now, it's no stretch to say that the social safety net is a multidimensional problem, and that's one of the reasons that Laurel is so well situated to help us think about it. She leads the Blue Meridian group, a really interesting philanthropic investor group that's working on the best ways to identify and remove barriers to economic mobility. She also happens to know something about housing, having led Enterprise Community Partners, where two of my good friends from school are doing great work in Portland, and having served as chief of staff at the Obama Department of Housing and Urban Development. So I'm glad she's here as well. Now, I want to kick us off with a generic question that I think can help us get into the conversation. It starts with an observation about the pandemic. One thing I think it's demonstrating for us again is that we're not very good long-term thinkers. We are short-termists. And the fact that we have short-term thinking crowding out long-term thinking is a real problem. We've taken that on in a really significant way in Oregon, in an aggressive way, by dealing with the fact that not enough people are saving for retirement. In Oregon, about half of people, same as the rest of the country, don't have any way to save for retirement. So in Oregon, we passed our own opt-out retirement savings plan. Now, this is another example why New Deal is so important, because the original idea for this came from Richard Thaler, Nobel Prize-winning economist, and his co-author, Cass Sunstein, himself a former speaker at New Deal events. And 3 years in, we now have 75,000 people who are on the path to financial empowerment and autonomy with their own funded IRAs. I don't tell you that story to brag, well, maybe a little bit on behalf of Oregon, but rather to indicate that there's value in thinking about things differently and in going first. We did this before any other state, and with some risk. So with all that as background, I want to repurpose slightly a conversation and a question I hear on a podcast I listen to regularly. And I want you both, Mayor Whaley and Ms. Blatchford, to imagine something magical happening. As we end this panel, imagine that somehow you are given unlimited political and nearly unlimited financial power. And I want to know, as a benevolent dictator, what you're going to do to modernize and strengthen the social safety net. Mayor Whaley, can we start with you, please?
Yeah, Tobias, what a great question. Something that we'd all like to be is benevolent dictators of our communities, our state, our country, and the world. And certainly, as I think about that, I think that what I would love to do right away, right after this, is to really increase direct funding to cities, of course, around building the safety net. You know, we are really passionate about the community development block grants that really go into areas that have seen disinvestment. And for decades now, there's been less and less money to really draw into those communities. And then secondly, I really believe in the idea of dignity of work and the idea that people want to make their community stronger and better. And putting people to work in their community is something that I think really needs to happen with a decent wage and benefits. And, you know, there's so much need in our communities, from, you know, reading to children, to cleaning neighborhoods, to building in our neighborhoods. It just doesn't make any sense that we don't put folks to work, it give them a dignity, it give them the paycheck, because I believe that people want to do that and they want to get paid well. Finally, I think the other key part that I would really dig into is this idea that we have so many corporations making so much money on the backs of low-wage work. And something has got to give, whether it's people that are waiting tables as wait staff, or the folks in our logistics and supply hubs making very little money and ending up on food lines at the end of the day. And frankly, that is not what America is about. America should be, if you work hard and play by the rules, you should be able to provide your family, full stop, regardless of what your job is. And we have gotten so far away from that in our country that is something I think we could change right away.
I'd vote for you for benevolent dictator. Ms. Blatchford, how about you?
It's such a great question. So really two things come to mind, and they all come back to resources, right? So first, the resources to really tackle this moment, this terrible moment we're in with the pandemic, public health resources, eviction prevention resources, small business, food, and I'm a working mom, childcare, all the things that people need to survive in this moment. And then secondly, resources to build this back better, right? And there's a lot of detail below what I'm saying, but just know that is everything from, improving access to capital, to minimum wage. I'm thinking here with a federal hat and what the federal government could do. This has a lot of implications, I think, for local government too, but access to technology so that people can continue working from home effectively, people can continue learning from home effectively, but really being able to build back better based on what we've learned from the pandemic so that we can adapt to a future, address things ideally like systemic racism and continued inequality. And again, there's a lot there underneath the surface, I think, and ideas of how to do that. Why not leverage that creativity to try to make sure this doesn't happen in the same way again? So I would say it comes down to money. I'm hearing that things may or may not be going anywhere right now. But again, if I were dictator, I would say, let's really design those programs really effectively at the federal level to support the local needs that we see on the ground in all those areas.
So there's only three of us here, so I don't think you should wait for me. If either of you have a reaction to something else someone is saying, just jump in. But to keep the conversation going, Ms. Blatchford, I definitely don't want to limit you to housing, but that's obviously an important part of your background. I wonder if you might share your thoughts. I mean, housing is obviously a big part of a safety net, and given your experience in the Obama administration, your observation of the Trump experience and your knowledge of where the Biden administration might be going, how should we all be thinking about where we are going, where we should be going?
Yeah, I mean, not to be overly partisan, but I think it's safe to say that the last 4 years have been immensely damaging, thinking about HUD, but also of the other agencies that are involved in housing, both the lack of funding, as it is already, 1 in 4 Americans, families who are eligible for housing choice vouchers get them. So there's still a huge gap between supply and demand. So you need that money. Mayor Whaley mentioned the CDBG program. I know that is a great program from the point of view of many, many mayors and does a lot of important work. That funding has gone down, right? Yeah, so need that. I would say a second thing is just the lack of civil rights sort of enforcement protections sort of focus, and that plays out in a lot of different ways. I think about from really furthering for housing, some of the bans that have been put in place around transgender family members, or the sort of where that intersects with immigration and immigration status is enormously complex. And then the third thing I think to really tackle is the treatment of communities, the way that the Trump administration has, whether it's focusing on sanctuary cities and sort of criminalizing them and demonizing them, or something I'm working on right now is like, what would we do next in Puerto Rico, right? The context of a post-disaster environment that's been handled immensely badly. So I think those 3 areas offer a lot of ways forward. And I think there is a lot to fix. There's also a lot, again, to, I think, build back on and do better.
You mentioned cities. I think we have someone here who knows something about cities. Madam Mayor, talk to us about this group that you're leading with some of your fellow mayors in Middle America, and why. I don't think anybody in this group is ignoring Middle America, but perhaps we're not paying enough attention to Middle America.
Well, thanks, Tobias, and appreciate someone from Oregon asking about the middle of the country. That means a lot to me. This was actually an idea from our friend Bill Peduto of Pittsburgh. And Bill has been talking about this Marshall Plan for Middle America for quite a few years and has engaged us in the Ohio River Valley, which hits multiple states, where we've seen a significant loss of disinvestment through manufacturing in steel over the past 4 decades. And his point where we see communities that have thrived, like Pittsburgh, Columbus, they have done well because they've had foundation support and institutional dollars that have been there. But there's still lots that have been missed in particularly rural areas and cities that just have recently gone through this manufacturing reset. We know that climate change issues are issues for us. Just last year in Dayton, we had tornadoes come through our city when they're not supposed to come through urban areas. We know that this is disrupting all kinds of things in our community. We got to get real about climate change. And we know there's going to be a big opportunity for energy jobs. What we're saying is we need to be thoughtful about where those jobs go. Past administrations have just let the jobs go wherever, and we need to make sure that we're investing in places that have seen disinvestment. And that is what this Marshall Plan is really talking about. In Ohio, for example, when the last great work by the Obama administration about energy opportunities and energy jobs, the only city that really saw any of that was Toledo. We're happy for Toledo, but while the rest of the state is losing jobs, particularly around its reliance on fossil fuels, we have to make sure that we're placing those jobs back, or we'll see the resentment that we see in our politics. And that's what we're trying to get away from, to really give opportunities for people to make a decent wage, something that this region has been the backbone of our country for hundreds of years. And so we want to make sure that we continue to do that work. And so I have to give Mayor Peduto a ton of credit on this. He has been our leader fearlessly on this work. And we do think, while it's this Middle America discussion, we think a lot of these discussions get across the country. We know a lot of our sister cities in Northeastern America have some of the same issues after the closing of mills, or different ways that the economy moves. And we have to be thoughtful about that, as if we just have a couple of communities that are big winners and a lot of smaller communities that are losers, we're going to continue to see the sowing of discontent in our politics and in our country, and that needs to stop.
It's a really well put point, and it's a point you make really effectively in the editorial as well, or the op-ed. So I hope and I trust Kelly and others will make sure that gets widely distributed to conference attendees. People should read that as well. So picking up on a point that I think was embedded in what you made, and to ask you both. One other thing that the pandemic has really laid bare is the way that vulnerable populations have really been especially affected. And I wonder if either or both of you hopefully have taken any particular lessons from that about where the social safety net has fallen short, and what lessons we should take from that about how we rebuild and strengthen it. So be eager to hear from both of you on that point.
Yeah, I'll go first. I know Ms. Blatchford is way more qualified in this, so I'll start a bit, and then I'm sure she will fill in with a lot more detail. We see just how unequal this pandemic has been, right? For example, those of us that are lucky to be in our homes and work from home and have broadband to be able to work from home, it's okay. We're still getting paid. It may be a nuisance about what to do with our children. We have some childcare issues, but we're doing all right. And we see this in the economic numbers, right? That low wage workers are feeling this pandemic at a tune of like 20%, less money in their pockets when they were already really struggling. So we see that. We see it in our frontline workers being more susceptible to the disease. We see it over and over on how, we already had really tough inequity in our communities in our country being exacerbated with this public health pandemic. And if we don't get federal funding in the next, 27 days, to really deal with the evictions, we're going to see it when people get pushed out of their homes with lack of rental assistance, and evictions come the middle of winter in my part of the country in January. And we've seen studies that show that will exacerbate an already tough pandemic on a health issue. So we have significant frustrations and things that it doesn't have to be this way. Is that, I think is something I say about every day. If we just really address the inequities in our system, we've seen it in testing, how testing was rolled out in poor areas. And, we worry about that in the vaccine rollout. So there are so many ways that this pandemic has laid down on our community so unequally. And we should really focus on those areas because they really shine a light on what is a problem even in normal times. And that's, I think, the big frustration that I see in this pandemic issue.
Great.
And just to build on that point, I agree with everything the mayor said and would just drill down on the issue of eviction, which as a houser is near and dear to my heart. I mean, I think the numbers bounce around, but current thinking is that around 40 million households are at risk. That there's different moratoria in place locally and at the federal level. The CDC has put some in place, but I think to your point, Mayor, it just proves how vulnerable these families are. And I would highlight as well, I've been part of a working group on this, and there's some really creative solutions that have come up to support low-income families, like right to counsel programs, bridge payments, escrow payments. I mean, the underlying problem is obviously unemployment and lack of employment. It also impacts, though, it has a cascading effect because I think a lot of us may think, oh, the big bad developers, like they're taking money. A lot of these people live in homes that are owned by mom and pop homeowners who maybe this is their retirement equity, or they themselves are the money. The gap in payment has to come from somewhere, right? Like, is it coming out of the tenant side or out of the owner? And then they have underlying financing. They may be secured to pay for this, and it's really a domino effect that I think is very, very harmful to everybody along the chain. And I just think, needless to say, housing is critical. I read a study preparing for this panel that came out recently. I'd be happy to share with the group. It just underscored probably what many of us know intuitively, that those who experience eviction, the rates of COVID go up, right? So you're literally putting people's lives at risk. And then the longer term rate of eviction, which has been documented many times over, including by people like Matt Desmond, it's just terrible for kids and families. And so we pay for it many times over there as well, with learning delays, with, complicated or uneven employment history, with people not being able to connect to the larger, access to opportunity that we all hope they will have. So I think that eviction, sort of the hole in the safety net formed by evictions is getting bigger and is just a real concern.
Amen.
So I'm treasurer in Oregon, and a lot of times people don't understand what that means. But one of the most important aspects of my job is being the state's chief investment officer. So I want to know, what is the best investment each of us in our various roles as New Deal leaders and supporters can make? What program should we be supporting? Should we be funding? What's the best investment for each of us to make in modernizing and strengthening a social safety net? I've stumped the panel.
No, I was going to say it's such a good question. And again, not to be parochial about my corner of the world, but I would argue that investing in affordable housing has so many ripple effects, right? It stabilizes families, which hopefully stabilizes their access to healthcare and things like that. Allows ideally for people to connect to schools and therefore, again, have access to those social services that are provided in other ways. So I think you really need to look at it as very highly interconnected and think about the ROI as being not just the program expenditure, right, or the debt financing that might go with a program to build a new unit here or there, but looking at it as it impacts people over the course of their lives. So I would say housing, but again, no surprises coming from me.
Well, I actually agree too. I think it's actually kind of sad, frankly, that that's where we have to be, because when we talk about, theory of higher need, we are in the conversation of housing and food. Yeah. And that is a really depressing thought if you think about it. Of course, a child needs a home, or if they're moving every single quarter, they're not going to be able to go get a strong education because of the nervousness around where I'm going to put my head out home every night, or mom's really nervous about being evicted out. So, I mean, I think that's where we are right now, because the safety net is so broken The discussions now, particularly in the pandemic, is how are we going to make sure kids have food, and where are they going to be, and make sure that they're warm and that they have something over their heads. Would I prefer us to be having a conversation about preschool, about the investment in education? Absolutely. But I'm telling you, kids cannot get educated if they don't have some place to stay at night, and they can't be educated if they don't have something in their belly. And it is incredibly disappointing to me that this country hasn't figured that out about its people. And that's the state that we are in with this safety net, and shows just how much incredible work we have to do for this generation we're bringing up.
I would just add, can I jump in?
Please.
So moving from like government, where all this is happening, to the nonprofit sector, where we're supporting a lot of this work, to now philanthropy, one of the most striking things is that there's so many people who are doing this in such amazing ways. So this may be too aspirational for the moment we're in, because we have so many immediate crises, but I think you can't discount the fact that not only could the social safety net be rebuilt, but it could be rebuilt better, right? Yeah, by using technology differently, new materials for housing construction, distance learning. And, I mean, there's just so much innovation and ways to do it that we see, again, in my, world of making investments. And it's like, wow. So this is even more doable. And I think then, we really need to make sure that it happens.
Laurel, we didn't set this up, but you gave me a perfect segue to the question I wanted to ask as we, I think, are coming sort of to the end of the time. Sometimes, in fact, one of our favorite New Deal leaders has said that R&D in the business world stands for research and development, but in politics, it might actually stand for rob and duplicate. And so I want to know, based on what you just said and others, what are those innovative ideas that we should be duplicating in our various communities? What things are you seeing in your work in your city, Mayor, and around that we should be picking up on and scaling?
Yeah, so I think right now we're seeing a tremendous amount of innovation out of necessity in education, right? For example, in Dayton, we have obviously been in remote learning, and the discussion now that the superintendent is moving is to do school through the whole year, right? To say, okay, look, the pandemic is really hard right now. We know the vaccine is coming. There's ways that we can do in-person learning later. Really recognizing, I think through this in education, we've recognized how important in-person education is and the value of it, but also how it can be done differently and how it can be really expanded, not to just traditional ways of educating. The other thing I think that has been really illuminative during this pandemic is how school systems have become the place of the social safety net. And I think there's a big question about, is that really right? Do we really think that schools should be the only place that services are given? And if so, what alignment should be with schools to help really give that support? Because I feel like we have a three stool bench here, and part of it, we've completely taken out social services. So the only thing that's left on that bench are police and teachers. And quite frankly, that is not enough, nor do they have the skills or the issues to deal with mental health, to deal with all the challenges that we have, housing, et cetera, because we've completely taken this third stool off, this third leg off. So I think that that's really the realization that we're coming in pandemic. I just hope that the federal government realizes that, because those on the ground know it, but it has to be done. It has to be solved with a real national answer, I believe.
Yeah. So I have 3 examples, Tobias, that I've seen in the last month that I think are really interesting. Back to that point. First, really interesting innovations around the right to counsel in eviction cases being pioneered. I'm thinking about a set in Denver, Colorado. Drawing on the fact that most tenants and most landlords don't want to go through eviction, right? Like, people aren't trying to be evicted and landlords aren't trying to evict them in this context especially. And so how to create sort of deduplicate paperwork, create systems that are more streamlined. Also, the courts are overburdened. So how do you provide really targeted access to counsel so that people end up with either escrow or repayment, or if there's a mistake, renegotiating rent, or if there's a mistake, that it gets fixed. Second example in some of our work is just really simplifying data sharing so that when people access benefits in one system, it happens across all the systems. I think some of the work that we've funded at BMP has relied on sort of emergency waivers and stuff around PII, but like, could you imagine a world where actually data worked in a much better way to support low-income communities? And then the third is, and I think we saw this with PPP, like just the amount of money that went to certain folks and not necessarily to small businesses, and in particular, small businesses run by people of color. What about using alternate credit or credit scoring tools? And there's a lot of them emerging that rely on really what I would call people's social capital in a community to prove their creditworthiness and therefore access capital to do what we're going to all need to do, which is, reopen the hair salon and the food store and all the things that make a neighborhood good once people start moving out, and about again after the pandemic. So those are three ideas. I'm happy to share more.
Please do when the time is right. Listen, we're almost out of time here, but when I am lucky enough to be on a panel, one thing that I sometimes get frustrated by at the end is, there was this one other thing I wanted to mention and we ran out of time. So I want to give that option to either or both of you. Was there something I wasn't smart enough to ask that we should have covered?
I think you did a great job, Tobias.
I wasn't fishing for compliments. I just meant that, if there was that thing that you wanted to get in. So if no obligation. So I appreciate it.
Why don't you talk about your son who was in the camera?
Yeah,
I saw him and I was trying to kind of ignore him, but
I thought it was great. You saw the scissors, kind of get the hand and the scissors. It was like, definitely we are all working in the time of COVID. It's very interesting. So
this is
well
COVID
done.
life. You have a view of the not so effective elementary school and middle school we're running here at home. So yeah, thanks for your tolerance of that. And thanks to both of you for being really terrific panelists. I took a lot from your perspectives and your lessons. I'm sure that's true for everybody else who's listening as well. And I also, those of you who are watching on the other platform are probably not seeing the screen that I'm seeing with several other people who are making this happen. So special thanks to Freddie and Kelvin, to Debbie and the rest of the team. And as we wrap this up, I'm going to throw it in just a second to the very talented Kelly, who is going to keep us on the straight and narrow as to the rest of the platform and the agenda. So thanks, Madam Mayor. Thanks, Ms. Blatchford. Thanks, New Deal. And over to you, Kelly.
Thank you, Treasurer Reed, and thank you also to Mayor Whaley and Laurel Blatchford for such an engaging discussion on such an important topic, especially as we begin to pick up the pieces following the economic shock of the pandemic. I'm Kelly Wicker, Chief Operating Officer here at the New Deal, and I'd like to thank all of the wonderful speakers that we've heard from today. It's been a pleasure to benefit from your expertise and your fresh perspectives. We hope that all of you in the audience enjoyed this opening plenary and that you're feeling excited about the chance to engage more directly through this afternoon's breakout sessions. This is our first major event held on Hopin, and we're excited about its potential to help us recreate the relationship building and the engaging conversations that happen during in-person events. We've already seen a lot of you using the chat to react to speakers and interact with one another, and we love it. We know that this platform may be new to many of you as well, so we wanted to briefly preview how this afternoon's breakout sessions will work. You're going to come back to this same event page at 2 p.m. Eastern today, and you'll head over to the Sessions tab, which you should be able to see right now on the left of your screen just below the stage. In the Sessions lobby, you're going to see 3 breakout choices, and you can click any of them to join. Once you get there, moderators in each session will tell you more about how the discussions will run. I also wanted to quickly flag the networking tab, which we'll have available for the half hour before and after each event period. This is a great place to meet new people who are here at the event with you. Hopin randomly pairs you with another attendee in the networking area for a one-on-one conversation on video. If you hit it off, click the connection button to exchange emails. Once your time has expired, Hopin will find you someone new to pair with. We hope this will get you the chance to get to know a few new faces. Thank you again for a wonderful morning, and we look forward to seeing you all back here in an hour and a half at 2 p.m. Eastern for our breakouts on expanding access to quality career and technical education, modernizing the transportation system, and using data to spur criminal justice reform. Thank you again to everyone, and have a nice afternoon.
Thank you.